Chapter 6. Communication is key. Keeping your partner in the loop. Talking with the doctor. You may be fortunate enough to have the kind of physician who sets aside as much time as needed to discuss your treatment plan. Even then, they, like us, remain a product of the cultural norms of their early childhood, as well as they are a product of their education and training. You, the partner, have to be the primary advocate for the prostate cancer patient. You must go to these appointments with him as a trusted prompter for new questions, a second set of ears, a recorder of discussions. He is under the stress of his healing situation and will forget knowing to ask questions, as well as have a difficult time remembering to speak up for himself and remembering to report any important information to the provider in your role as a backup coach, as a secretary, as an advocate is important. Asking the physician questions clarification. This is extremely important, and a way to do this is to paraphrase what you just heard. What I just heard you say is opens the door for the doctor to think about you and to understand what his or her words meant to you. Misunderstanding, even a lack of clarity, can then be corrected. Seeking more information could be done with a phrase like, "What happens if?" More details could be asked for by simply saying, "Would you explain that further?" Medicine, especially the specialty of cancer, is a foreign world to most people. Asking questions of the doctor or nurse can feel intimidating because they are the experts and you are not. However, it is important that you focus on the needs of your partner and in a manner that does not question the doctor's expertise or authority. Even though some doctors are quite good at inviting you to feel inferior, being an advocate for your partner is also being an advocate for yourself. As with all communication under pressure, this requires diplomacy and assertiveness on your part. One study found that 41% of patients observed ask a direct question most about diagnostic tests. 18% ask the question indirectly. The number of questions in the interaction was counted, and it was observed that the medical specialist asked 9 questions, physical symptoms. Look for gaps, not when the doctor's in mid-sentence, to ask your questions. Yes, there are times that you need to break their pattern because some of them have learned to avoid questions from the patient. There are occasions when interrupting is the only way to get a question into the conversation. Again, if the information you are receiving or have asked for is not providing you what you need, you can always ask again. Please tell me why, Groix. Or, can you please repeat that? Both of these are a gracious and respectful phrases that invite interaction. Writing down your questions and concerns to take with you to an appointment can help you be more comfortable as well as permit you to create a hierarchy of importance. Doing so with your partner is a good communication practice. Like any contractual arrangement, you can give notice to the doctor at the time you start the appointment that you have prepared some questions that you would like to ask that day. In instances where you might be ushered out for a particular exam, it would be a good idea for you to ask for a separate appointment. Tip: explain to the receptionists that when you call to book an appointment or right now as you are booking that appointment, that you would like to be given the last appointment of the day. This can be a way of ensuring you have additional time. Or ask for the first one in the morning. If it is the first one, you likely will not have to spend a long time in the doctor's waiting room. Talking with one another. Research confirms, as you may well yourself be aware, that many couples actively avoid talking about death and sex. It further validates that partners of men with prostate cancer are often more distressed than the man himself. Cancer is a game changer that now adds the stressor of the man's masculinity taking a hit as well as the impact on the sex life of the couple. Your entrenched patterns may be that one of you is the talker and the other is a silent listener. During these stressful times, the talker may need to be the silent listener and listen deeply for what the other person is thinking, as well as the other person is feeling for more effective shared communication. A word of caution. The silent partner may attempt to figure things all out on their own. This might result in the talker talking more and, by inference, demanding more, which results in the silent partner withdrawing more. The main thing to consider here is that old patterns are not always effective in new and difficult situations. It is noteworthy that the meaning of the communication is not what is perceived by the listener. The man may treat the disease as an inconvenience, or as the partner interprets the diagnosis as a potential for her becoming a widow, or a future absent of physical or emotional intimacy. Obviously, you appreciate how they would think about it quite differently, and neither talk or avoid talking about it differently as well. Both wanting to talk and or avoiding talking has the potential of increasing stress and eroding relationship closeness. Couple communication tips. Time for talk. When something needs to be said, treat it with the importance that you would for making and keeping an appointment or meeting. Both of you set down. Standing can make communication more intimidating to many people. Converse in I statements. We've all heard suggestion many times. Doing so takes ownership as well as reduces assumptions about what the other person is thinking or feeling. Starting a sentence with, "You make me feel underscore underscore underscore," is a guaranteed way to evoke defensiveness. Practice things like, "I feel so alone and abandoned when he stays silent and don't let me know what you're thinking." Name the problem. Figure out what you want to talk about and how you will know you have achieved your desired outcome. This will help in reducing the tendency to rattle off a smorgasbord of issues that end up having your partner feel threatened and overwhelmed. Going back to the I statements, what is the real issue? You're worried about him because you do not know what he is thinking, or you're feeling angry because he is no longer watching his cancer instead of treating it aggressively. Listen, he probably thought you were already doing that. Are you paying attention to your partner's body language and nonverbal behavior? After you have stated what you want to talk about or was bothering you, stop talking. Most of the time, because our society socializes men to take control of conversations, just let them talk, and he will most likely tell you what you need to know. Be flexible in your response. You may not hear what you most want to hear, but you will be hearing it from your partner, and wasn't that the point of having the conversation in the first place? This can be challenging, especially when you're worried, frustrated, upset, and you find yourself began to cry, shower, or hyperventilate. Remember that most men have growing up being told and with models of how to respond to other people's emotions, messages, emotions. The tendency might be to not show their emotions or becoming aggressive because I have a hard time dealing with emotion, and others, their withdrawal can really be a cover-up for feeling helpless because they don't know what to do. And by the way, not something you exactly need. Correct? Avoid nitpicking. Are you throwing in your gunny sack loaded with built-up hurts and really not seeking a resolution? Picking on multiple issues, no matter what the size, is non-productive and can cause him to withdraw even further, leaving you feeling frustrated and bitter.